After all, I have the blood of Africa within me, and my family's own story encompasses both the tragedies and triumphs of the larger African story.
This is Kogelo in Kenya's Nyanza province. It is the birthplace of Barack Obama's father, and among the poorest regions in Kenya. It has one of the highest mortality rates in the country, mostly from HIV/AIDS and malaria.
If Barack Obama had been here and been a child, he may not have made it past his 5th birthday. And if he'd made it past his 5th birthday and didn't have malaria, didn't die from malaria, here, young men have up to 40% HIV prevalence. So then he would have had, almost a 50% chance of being HIV infected. His life could have been very, very different. And that's the life of the people who he would have grown up with, the people that are in his family or in his neighborhood. Those are the challenges they face.
My father traveled to the United States a mere 50 years ago. And yet now I have family members who live in villages. They themselves are not going hungry, but live in villages where hunger is real.
One of the biggest problems in Kogelo and Nyanza is HIV/AIDS.
The HIV burden in the Nyanza province is the highest at about 15%. The national prevalence is about 7%, and about 80% or a little more than 80% of Kenyans don't know their HIV status, so are unable to then seek care and treatment.
Because Kogelo is very remote, people have difficulty accessing HIV testing and treatment. A new home-based testing and counseling program run by the CDC is allowing more people to access these services.
VCT or HIV counseling and testing services had been there before, but many people could not access the services, maybe to some factors like transport, going to that place, distance. But now home-based is just to their doorsteps, and this is where we take the services to them.
Koro made pima lure kute makelo tuo marayaki en gima ber maka ng'ato kawo mondo mi ong'e chal mare. Nikech ong'eni kute gi osehinyo kuonde moko, to mae okang' kende ma wanyalo tiyo go landruok kute makelo tuo marayaki. Remo nyalo chwer matin ka wachuoyo, bende duoko mari mar kute mag ayaki be nya chwanye. To ber mantiere en ni ka duoko yudo ni ng'ato nikod kute mag ayaki, inyalo rit korka thieth ni kute mag ayaki e klinik man machiegni machiwo rit ni jogo man gi kute mag ayaki. E kar thieth mar joma ni kute mag ayaki, ibiro miyi yedhe ma itiyogo kuom kute mag ayaki. Nonro mar DSS ok bi chulo kuom yedhegi, to ichiwo gi nono kuondegi gi migawo mar thieth.
Rapid HIV tests, which give responses in less than 20 minutes, allow for quick diagnosis and provision of services.
So this really promotes the better health, because once people know the HIV status, they're able to prevent the transmission. It's also important because it captures the entire family, compared to VCT where maybe one individual will just visit a VCT center and maybe had left the family at home.
In much of Kenya, stigma associated with HIV prevents discussion of the disease. When Barack Obama visited Kogelo in 2006, he got an HIV test in public to encourage others to do so and to reduce stigma. Home-based care also addresses this issue of stigma.
We are taking these services to every person, so it has really helped us to reduce stigma, where the next home we are doing the services, we are providing them with our HIV testing and counseling services. The next home, the same. So when these people, at times they sit together, they're able to share the information.
Barack Obama has had a very different life than his cousins in Kogelo. His journey helps Kenyans and Americans understand each other and shows us how connected we are.
Thinking about Obama being from Kenya helps Americans understand the global kind of world, but I also think that it is important for them to know about malaria or HIV or some of the illnesses that they may not see daily, but certainly affect the world and therefore affect them because the world is so small. And so it's important that Americans understand those illnesses and contribute to their improvement through, you know, CDC's work and other U.S. government agencies that are in Kenya and other countries working on those diseases are really working for the whole world. So I think it's important. And I think Obama kind of helps Americans understand how small the world is.